Okay, well, welcome and good morning or good afternoon to everyone on the line. Just before we get started, in order to hear the audio, you all should be seeing a slide here in the webinar screen that gives you a call-in number, an 866 number to call in. Once you call that in, you'll need to enter the access code. That's the 703 number there below. Just before we get started, make sure that everybody can hear us. Just as a point, a logistical point and a housekeeping point, all lines except for our presenters will be muted here this morning. As we go through the webinar, you feel free to ask questions throughout the webinar. Down in the lower right-hand corner of your screen, there should be a Q&A box that's labeled Q&A, and please feel free to type those questions in as we go along. And then at the conclusion of the webinar, we will continue to keep your lines on mute, but we will announce those questions to our presenter today, and he will answer those as we go. So again, good morning and welcome to our Euthanasia Guidelines webinar. This is a joint venture between the National Dairy Farm Program, Animal Care Program, and Merck Animal Health. And my name is Emily Yeiser-Stepp. I'm the director of the farm program, the Farm Animal Care Program, and we are pleased to have everyone on the webinar today. For those of you who are interested in either seeing webinars that we've formerly had recorded, we've had 2 webinars so far, so this is our 3rd one. We will also have an additional 7 webinars that are scheduled currently. Please feel free to go to that website there on the screen, the bit.ly/mercwebinars for the full schedule. And if at any time, if you have additional questions related to the Farm Animal Care Program, feel free to email us at dairyfarm@nmpf.org. Our next webinar, just as a preview, a little teaser for everyone, will be handling non-ambulatory cattle. And that date and time are yet to be determined. Most likely it will be still the week that we have it scheduled at this point, which is in 2 weeks. But we are still trying to nail down the appropriate time for our presenter, who will be Dr. Craig Crosley of Countryside Veterinary Service. So please keep a lookout for that date and time as to when that will become available. So we are pleased this morning to have Dr. Jan Shearer of the College of Veterinary Medicine at Iowa State as our speaker today. Dr. Shearer serves on the Iowa State University College of Veterinary Medicine as a professor and extension veterinarian. In cooperation with extension faculty from the Department of Animal Sciences and Iowa State's statewide network of county and regional extension specialists, he is responsible for the development and delivery of veterinary extension programs designed to meet the needs of Iowa's cattle industries, veterinarians, and the allied agribusiness industry. Dr. Shearer's primary areas of research interest are lameness and welfare issues of beef and dairy cattle. He's probably best known for establishing the Master Hoof Care Program, a training program designed to teach on-farm employees how to properly care for foot problems in cattle. This program acquired national and international attention for its impact on foot health in dairy cattle and was fittingly recognized by the USDA Secretary of Agriculture in 2003 with the Honor Award for Outstanding Innovation in Animal Health. He is also a diplomat of the American College of Animal Welfare and serves as a board member and scientific advisor to multiple organizations and dairy operations. Dr. Shearer has been honored by the University of Florida, by Ohio State University College of Medicine, and by the American Association of Bovine Practitioners with the Award of Excellence, and finally by the AVMA in 2011 as a recipient of the Animal Welfare Award. So we are pleased to have Dr. Shearer here today. And before we get started, I just want to discuss a little bit about the overall program that we have here in conjunction with Merck Animal Health. Merck Animal Health and the National Milk Producers Federation formed a partnership over a year ago to help ensure a comprehensive industry-wide approach to employee training and animal care in the dairy industry. Through the partnership, dairy producers across the country have access to tools, resources, and workshops available through Merck Animal Health Dairy Care Initiative, an extension of the Dairy Care 365 Animal Handling Training Program. This webinar series further builds upon the strong partnership that has been forged in support of the significant efforts of dairy producers to continuously improve the care and handling of their animals. This is the third of 10 webinars that will cover various animal care topics, which are designed to help dairy farmers meet the new requirements of Farm version 3.0. The live webinars will also be recorded and hosted on the Farm website for viewing later, along with the Merck Animal Health Dairy Care 365 Animal Handling Video Training modules. The Dairy Care Initiative was designed to complement the Farm program and helps producers meet those Farm requirements, including creating a cow care agreement, developing written standard operating procedures, and providing employee training. The Dairy Care Initiative was developed to help farmers provide the best animal care by maintaining sound policies, hiring the right people, and making sure they are properly trained. Since its creation, over 50 workshops have been held in 23 states to help dairy farmers and their veterinarians tailor the dairy care materials for their farms. So with that, we would like to now turn it over to our presenter for the morning, Dr. Jan Shearer. And Dr. Shearer, the floor is yours.
Thank you very much, Emily, and thanks to Merck Animal Health, National Milk Producers Federation as well for sponsoring this webinar. Today the topic is going to be, of course, a discussion of euthanasia, not the most pleasant topic, but certainly I think a very important one. And one that I think in the last few years we've made some progress in terms of changing some of the ways we go about this thing to make it more successful, more effective, because if there's any procedure that you certainly want to have go right, it's certainly euthanasia. So I'm going to focus my attention on trying to share with you some of the key points relative to managing this particular procedure and getting it done correctly, so that you don't have those very unfortunate situations that can occur when maybe we don't get it done correctly. I think certainly when we think about humane euthanasia, and again, just to point out why it's important, there are situations that yes?
He can't hear something? Okay. How can I ask him something?
Sorry, we're going to mute all the lines and actually have the Q&A in the box at the bottom right to ask any questions. So go ahead, Dr. Shearer. Sorry about that.
Oh, okay. So certainly, why is it important? I think it's important because there are those situations that occur from injury or disease from time to time that result in uncontrollable suffering. There simply is no medical means available to us or other means short of euthanasia as a way to provide relief in those particular situations. And so it's important that we understand the procedure and everything that is entailed in getting it done and getting it done correctly. Certainly, it also, if we think about our role as caretakers, we have a moral responsibility to provide animals with their basic needs: food, water, shelter, protection from predators, medical care as needed, and certainly, when that time comes, a humane death. This is the ancient contract, that unwritten contract between animals and man that I think is so important and certainly comes to mind when we discuss the issue, certainly, of euthanasia. Mainstream America believes in this concept as well. I think that's important. They want to be sure, in fact, that we, as caretakers of animals, are respecting this contract, that we're doing our level best to make sure that we preserve the welfare of animals. And so it's important for those reasons. certainly to make sure that we do this correctly and that we do this when it is necessary. There are multiple indications for euthanasia. It may be fracture, trauma, disease, loss of production or quality of life, disease conditions for which no effective treatment may be known, maybe conditions such as Johne's disease, for example, or lymphoma. Certainly diseases that would involve a significant threat to animal health, such as rabies, and many other conditions that we come across in working with animals where euthanasia is indicated. And so there's all kinds of reasons for why we need to know how to do this procedure and need to be able to apply it when it's necessary. There are three basic methods we have available to us. One is the use of an anesthetic agent such as a barbiturate or barbituric acid derivatives. Ones that we might use more frequently on the farm situation might be gunshot or penetrating captive bolt with secondary methods to assure death. We have both a penetrating and a non-penetrating captive bolt, which I'll just talk briefly about here later on. But generally speaking, we want to use non-penetrating captive bolt only on younger animals. The penetrating, non-penetrating captive bolt systems that we have available for field use and euthanasia would really only apply primarily for use in young animals. We're going to use penetrating captive bolt most of the time for our uses with adults. That's an important quick overview of our methods. I want to do a little bit more discussion of each of these systems and talk a little bit about advantages, disadvantages, and so forth. Certainly when we look at the use of an anesthetic and anesthetic overdose, it generally results in a very smooth transition from consciousness to unconsciousness and death. Many people watching this would say that really is the better way. But in reality, when you're working with animals that have limited exposure to humans and may be a little less comfortable with human contact, in fact, this kind of a method might be much more stressful. And so while it looks very smooth from transition to consciousness and unconsciousness and death, the reality is because it requires restraint and because it requires that we get a needle into the vein, it can be somewhat stressful for animals not used to human contact. But there are many other deterrents to this method need to be considered as well. One is certainly cost. Working in large herd situations where euthanasia may be one of those conditions and one of those procedures that needs to be done on a relatively frequent basis, this can get to be quite costly. Administration requires restraint. As we mentioned earlier, the administration itself of the drug must be done by a veterinarian who's registered with the U.S. Drug Enforcement Administration. Strict accounting of all drug must be kept at all times. That becomes a real headache at times because we must account for every single drop of that particular drug. Carcass disposal is complicated indeed by the drug residue from the use of a barbiturate, and that becomes an important consideration, particularly when we look at situations where carcasses may not be disposed of properly. They can pose real risks for wildlife. So there are a number of potential deterrents to the use of anesthetic agents for routine euthanasia of dairy and beef cattle. The other thing that I think is important to just mention quickly is that what are the effects on the fetus? Quite oftentimes we're focused on euthanasia of the adult animal, for example. It may be an animal that we realize is in fact pregnant as well. And so what are the effects on that fetus? And so that is a question that's raised quite oftentimes. When we use something like pentobarbital for the euthanasia itself, we find that the barbiturates are readily across the placenta, and we get very significant fetal depression, but death of them will precede death of the fetus by as much as 20 to 25 minutes or so. And so the question then that comes up is, what is the fate of the fetus? Does it die an inhumane death when its mother is euthanized? And the preponderance of information would suggest that, well, no, probably not. In fact, although the fetus has the capacity for sentience, that means it can experience negative and positive experiences and things. The reality is that while this fetus is in utero, while it's in the uterus of the cow, it's maintained in a sleep-like unconscious state by a series of 8 or more known neuroinhibitors that maintain this animal in an unconscious state. And as Dr. Miller, who's done much of the work on this particular issue of the effects of euthanasia on fetal welfare, says for an animal to experience something, whether it be positive or negative, it must be both sentient and conscious. An unconscious animal experiences nothing. So while the fetus is maintained in the uterus and has the capacity for sentience, it is in an unconscious state, and therefore will simply proceed to death without experiencing the sensation of drowning or other, negative sensation in the process of death. So I think that is comforting and an important thing to keep in mind as we're approaching these procedures, and in particular where we know that this is an animal that is in fact pregnant as well. Carcass residues, as I mentioned, are an issue and certainly a risk for scavengers. You can go on the internet and certainly you will find this from time to time reported in newspapers and so forth about an animal that has been euthanized and that animal's carcass consumed by wildlife at some site. It could be bald eagles, it could be buzzards, it could be animals at a wildlife park, as we see as the case was in northwest Reno, Nevada, where euthanized horse was fed to a wolf and a tiger and sickened a cheetah as well. These kinds of things occur from time to time, and it's important to keep in mind that certainly when animals are euthanized using a barbiturate or an anesthetic agent, it's very important that we dispose of that carcass properly. Physical methods of euthanasia, firearms, and gunshot is one of the most common ways. Of course, here in America, we have a lot of firearms. Most people own a firearm of some sort. Penetrating and non-penetrating captive bolt also is another method that is commonly used by folks today. There are advantages to that system as well, and we'll talk a little bit about those as we look at these in a little more detail here. Firearms or gunshot is the most common method used for on-farm euthanasia of cattle. Certainly, as you would expect, the effectiveness depends upon the selection of the appropriate firearm, certainly the type of bullet or shot shell if we're using shotguns, and the accuracy, certainly, of our aim. I like this from the Euthanasia Guidelines in 1993. Probably should have it in there again just to reinforce the point that when this particular procedure is properly applied, and euthanasia by gunshot or either a penetrating captive bolt will cause less fear and anxiety and induce a more rapid, painless, and humane death than can be achieved by most other methods. Albeit it is, in the eyes of many people, a more violent way or method of euthanasia, and is disturbing for many people for that reason. But in reality, when it comes to finding a method that is really very quick and very humane and certainly reduces in many cases, the stress associated with restraint and so forth, in many ways, you find these physical methods have indeed an advantage over something like barbiturate for the use as a cause or as a method of euthanasia. The firearms that are normally recommended for euthanasia cattle would include handguns somewhere in the range of calibers between 32 and 45. The Humane Slaughter Association has recommended that over the years. We use calibers in that range for handguns. Rifles, a 22 Magnum or higher caliber rifle would be recommended for use of rifles. The 22 long rifle, which is a very common firearm, does not provide consistent results for euthanasia of adult cattle based on some of the studies that have been done. And there have not been a lot of studies done, of course, but certainly of those that have been done, we find that the 22 long rifle tends not to be the best for consistent euthanasia of adult cattle. They simply do not have sufficient muzzle velocity in that bullet to cause the kind of destruction that we need of the brain. In fact, in some cases, that bullet is unable to penetrate the hard skull of an adult bovine. So that becomes problematic in this case, because certainly one of the first requirements is that the bullet is able to traverse the skull to enter the brain, because it's the brain is where we need to create sufficient damage to cause unconsciousness and, of course, eventually death. Shotguns are excellent option. Okay, 410 to 28 gauge can work in adults. They're oftentimes recommended more so for calves, but they can work as well sometimes in adult animals. But if you're going to use it consistently for adults, then you're using a shotgun, a 12, 16, or 20 gauge would be probably a little bit better for cows. I think many people misunderstand or misinterpret the lethality of a shotgun at close range. These are very, very effective firearms, or very, very lethal firearms in close range. Buckshot would be my choice of shot to use in that. Number 4s or number 6 birdshot is also used. I prefer something where you have a little larger BB shot, but nonetheless, these are effective at close range. Within 3 feet or so, 3 to 6 feet, these are very, very lethal and a very good option. We also, when we're looking at the use of something like a handgun or even a rifle, we want to use solid point bullets. Quite frequently, people use, of course, hollow point bullets for the purposes of hunting, where they're using the bullet primarily for a center of mass shot in a chest or thorax region. But when we're trying to traverse the skull again, we want to use a solid point bullet or something that is more likely to penetrate the skull. Many of our hollow point bullets will fragment as soon as they make contact with the skull, and as they fragment and as they mushroom out, they're quite likely to not maybe pass through the skull and get into the brain, where they're going to be able to cause the kind of tissue destruction that we need to assure death. So the recommendation on bullet selection for firearms, of a handgun or a rifle type, we want to use solid point bullets. When we move on to penetrating and non-penetrating captive bolt here on the left side of the screen here, we see the penetrating captive bolt. Essentially, the bolt that is used in the packing plant situation is a penetrating captive bolt that enters the skull, goes about 3.5 or so inches into the skull. It's designed to cause, of course, an immediate loss of consciousness. Then as the animal is shackled and moves around to the bleeding rail, it's the bleeding of this animal that will assure death, of course. And so exsanguination is one of the ways then that we use to assure death in bovines when we're using a penetrating or non-penetrating captive bolt. Here on the right, we see a non-penetrating captive bolt. It has a mushroom-type head. I'll give you another look at that here in just a second here so you can see what that looks like. But penetrating captive bolts, there are several of these available. Cash Special is a common one these days. The one here on the left is kind of shaped like a pistol. Then we have the inline version of this, and the Shearer here on the right photograph. And there are others that are available as well. There's a Blitzkerner that is also available, many people have used. These are all good devices, and they all work very nicely. And the important thing is to know proper use of the devices and to make sure that you maintain them adequately and keep them clean. This is the non-penetrating captive bolt. Here we're looking at the mushroom head here in the lower right. That's the knocker head or the mushroom head type bolt that is used with that particular type of device. And again, these are used primarily for younger animals, not so much for adult animals. When we're using the penetrating captive bolt here, as you see here in the slide or in the photograph here, we want to make sure that the muzzle of the captive bolt is placed firmly against the surface of the skull before we fire it. That is a really important difference between these two devices, that is firearms versus captive bolt. We would never ever want to place the muzzle of a firearm against the skull like that, because if we fired it with the muzzle against the skull, it could explode the barrel, of course. Whereas with the muzzle of the captive bolt must be placed firmly against the surface of the skull, because remember, that bolt's only going to be extended somewhere around 3.5 to 4 inches or so, and so we need to make sure that we're against the skull when we use that. And so that's an important difference between the use of captive bolt versus firearm. One other point that I would make here, as you see here in the photograph here, what we normally do and what I nearly always do, because of what I've just said there, because it's so important that we keep that muzzle firmly placed against the surface of the skull, I normally will put a halter on the cow's head just to prevent any movement that might occur as I'm preparing to fire. So I think that's also worth taking just a minute to do that in most cases when you're using the penetrating captive bolt. The lethality of the penetrating captive bolt, though, is an important thing to keep in mind because we've found that really because we don't always cause death with it, that it's important to always use a secondary step, okay? So I always use a secondary step when I'm using something like penetrating captive bolt or the non-penetrating captive bolt, because even though it does cause a significant amount of brain damage, we can't be sure that in all cases this animal may not regain some level of sensibility. And there's some pretty good work that's been done on this by Dr. John Gillen at Oklahoma State University, where he's looked at the use of Cash Special using that particular device, the one with the extended bolt, which goes about 4 to 4.5 inches into the skull, that about somewhere between 85 to 90% of the time, he can expect death to occur without the need for a secondary step. But it's not 100%. And so the point I want to make here is that I just automatically, when I use something like penetrating captive bolt or non-penetrating captive bolt, just automatically apply a secondary step in all cases, because death is not assured by the captive bolt alone in those situations. So the adjunctive methods that you could use would be, for example, exsanguination or bleeding the animal out. That has some biosecurity concerns associated with it, and it is unpleasant to watch, of course. And so exsanguination isn't my first step, but it's one that I can use if necessary. Pithing, whereby we place a rod through the hole that's created by the penetrating captive bolt, we can cause additional damage, particularly to the brain stem in the brain, and that will assure death in many cases as well. And so that's a very good follow-up step. The other one is an intravenous administration of a saturated solution of potassium chloride. Potassium chloride is a salt solution, and when we use a concentrated solution of that, that's 340 grams of potassium chloride in 1 liter of water will pretty much saturate the solution. An injection of that somewhere around anywhere from 60 to 120 cc's, or at most 250 cc's of that particular solution will cause cardiac arrest and assure death. And that one is one that tends to be my preference normally, because it does cause cardiac arrest, which assures death, and it also does not cause any risk for wildlife as well. You can use, in a pinch, of course, a second or a third shot to cause additional brain damage, but normally if I have my options, I would rely on either exsanguination pithing or the saturated solution of potassium chloride as a way to assure death. Potassium chloride, of course, can be acquired. It's water softener salt. One form of potassium chloride is water softener salt. The other, of course, is sodium chloride. And so potassium chloride is available sometimes to you as water softener salt. So potassium chloride, and particularly since it's for purpose of euthanasia in that case, that's another source for you, a ready source for you. Exsanguination, of course, is done by using a knife to sever the carotid arteries, the jugular veins. It does take a little bit of time, 10 minutes or so, for this animal to bleed out, but it is a very effective way, of course, to assure death as a secondary step. It does cause some biosecurity issues, though, because of all the blood that you have left in the area, and so that creates not only a disturbing scene for you, but also some biosecurity hazards for you. The pithing procedure is just essentially to insert the pithing rod through the hole in the skull produced by the captive bolt, direct it to the brain stem, and then manipulate that device then to induce additional damage. And that is a very effective way as well. And then potassium chloride, as I said, is another step that you can use. This is the important thing about this, is that you would never ever use this in an animal that is conscious. This is for use in unconscious or anesthetized animals only, right? An animal that is unconscious, in other words, we would never use this in a conscious animal, because it does cause death by causing cardiac arrest, and that would not be a pleasant death for this animal. So we want to use that, and we want to use that either by intravenous injection or in some cases by an intracardial. In other words, injecting straight into the heart is another way to do that. And again, as I say, there are no risks to scavengers, and so that's one of the advantages of that particular system. So as soon as the animal is confirmed unconscious, then we can go ahead and inject. I usually use about 120 mLs. It's rare that I would need any more than that. I can pull up additional 60 cc syringes full of the potassium chloride solution. Once I've captive bolted the animal and I have assured that it is unconscious, in other words, by touching its eyeball and there's no corneal reflex, then I can go ahead and follow up then by injecting rapidly the potassium chloride. And so about 120 cc's at a minimum is what I normally will use. Then I will check the heart. If there is still evidence of a heartbeat, then I will go ahead and inject more, of course. The thing is, I want to stop right here and just mention quickly that I think oftentimes people are surprised that the heart continues to beat, but in fact, the heart will continue to beat even with very significant brain damage. The heart will continue to beat for at least 7.5 to 8 minutes afterwards, because the heart is not controlled by the brain. It's controlled by the sinoatrial node, a structure in the right atrium of the heart that sends out an impulse, an electrical impulse across the heart muscle that keeps, that is also responsible, and of course then for the heartbeat. So the brain is not the driver of the heart function so much as the sinoatrial node. So the heart will continue to beat in an animal that's been properly made unconscious with captive bolt. That is to be expected. Magnesium salts can be used as well. Magnesium chloride, Epsom salts, in other words, can be used, again, only in unconscious or anesthetized animals, so that's another option for you. I would give this again by rapid intravenous or intracardial administration, only in anesthetized animals. And again, this will not be a risk for predator scavengers either, so that's another option for you. Always confirm that the animal is unconscious before applying this adjunctive method. As I have said, you need to know the indicators of unconsciousness. Let me go through them quickly for you. If the animal is standing and you captive bolt, or when you fire your firearm at the proper location, the animal will collapse immediately. It makes no attempt to right itself. You'll notice that as the animal, as soon as it hits the ground, the body and the muscles will become rigid immediately after the shot, followed by brief tetanic spasms and eventually some uncoordinated hind limb movements. One of the things that I think is most obvious, though, is there's an immediate and sustained cessation of rhythmic breathing. The animal may be breathing rapidly, depending on the situation at first, whenever you first use the captive bolt, but as soon as you render the animal unconscious, there is an immediate and sustained cessation of rhythmic breathing because the bolt or the bullet, in the case of a firearm, causes sufficient damage to the respiratory centers to actually stop all breathing. So that's an important indicator of unconsciousness. So this immediate and sustained cessation of rhythmic breathing, an absence of all eye reflexes, those are key things to be looking for. And animals should never make any attempt to right themselves. If they do, it's time to use the captive bolt or firearm once again. Again, confirmation of death is cardiac arrest. But note that even when the shot is properly placed, the heart will continue to beat for a minimum of 7 to 8 minutes, sometimes longer. No respiratory activity should be noted, of course, and there would be no corneal reflexes. Those are key things to watch for, and of course, rigor mortis is a sure sign of death as well. So check for corneal reflex as soon as you use the captive bolt. One of the first things I go up to do, I go up on the top side of the animal, as you see as I'm positioned here. I will touch the eyeball for evidence of a corneal reflex, and then I will also, at the same time, be monitoring for evidence of respiratory activity. Any respiratory activity would be an indicator that I need to use a captive bolt or the firearm once again. But if there's no respiratory activity, there's no corneal reflex, this assures me that this animal is in fact anesthetized, and that's what I need to know before I follow up with a secondary step. And normally what I would do, as I say, would normally follow up with with potassium chloride, in which case I would still monitor these particular things, but the next thing I'm going to do, since I know that potassium chloride is going to cause cardiac arrest, I'm going to monitor the heart very carefully. So those are important indicators of unconsciousness and death, and it's very important that when you're training folks, they understand how to look for those kinds of things and how to confirm unconsciousness and also how to confirm death. The other thing I think is so important, I think you need to keep people, get people to keep themselves associated or keep themselves close to the animal until this animal is confirmed dead. That's so important. I think oftentimes people have a tendency to want to captive bolt something or use their firearm and go away and leave. And I think that's all understandable. On the other hand, what we really need to do when we're training folks to do euthanasia, we need to make sure that they stay with the animal until death is confirmed. That's the proper way to do euthanasia, and we don't want to leave there until we have confirmed death. Anatomic sites for euthanasia using physical methods is a very important thing to take a look at as well. We look here in the photo here on the left. Again, this is from Dr. John Gillam's work at Oklahoma State. He shows that when we use the methods that, in fact, were the recommendations just a few years ago in our organization of bovine practitioners and also the AVMA's recommendations, to go from the inside corner of the eye, the medial canthus, to the top of the opposite ear or to the base of the opposite horn. We go right on the intersection of an X made at those two sites. We see that, in fact, when we look here on the right, in this photograph here on the right, you see where the arrow was pointing, you see that where the bullet or where the path of the bolt has gone, and it's actually missed the entire brain. Because if you look here at this, here's the brain back here. The brain is back here, and of course the bolt path is way ahead of that. And so this is an animal that really would have suffered a great deal of distress as a consequence of that particular shot. So it's very important then that we go higher, and the way that we have looked at this in recent time is we've found that if we go from the outside corner of the eye to the base of the opposite horn, then go right on the intersection of those two lines, that in fact that moves that site up to the point that we're able to go right directly at the brainstem, which is where our target is in the first place. And so we want to go on an intersection of two imaginary lines, each drawn from the rear of the eyes to the base of the opposite horn. And that's going to be much more likely to get us to the thalamus and hypothalamus of the midbrain, the pons, the medulla oblongata, this area here. This is the area that we're trying to reach with our bullet or with our bolt, captive bolt, because it's these tissues right here, this midbrain area right here, that when we get damage to this structure right here, it assures death. It assures that we're not likely going to get any possibility of a return to consciousness. So this is our target. And if you think about that, that's not really a very large area. So that's why it's very important that we use the proper anatomical sites for making this shot. Here's another example here. Here we have in the bolt entry site here at a proper site. We see it coming down through. You see the track coming down in here. And in fact, we've even pushed a part of the skull down into the thalamus and hypothalamus here in this particular shot. And this is what we're aiming for. This is what we're trying to accomplish. So when we get damage to the midbrain area here, then we can be much more likely to cause death without the possibility of a return to consciousness. So the way that we can look at this, if we could draw a line across the top of the pole, okay, and another one across from from lateral canthus to lateral canthus, or outside corner of the eye to outside corner of the eye, and across the pole, as you see right here, and go right in the middle of that. That'll put us right in the center of the forehead and right approximately at exactly the same site as the X that we had drawn from the outside corner of the eyes to the base of the opposite horn, or where the opposite horn would be if this animal had horns, for example. So these two sites, or these two ways of finding this site, are, I think, important because it's good to check yourself when you're doing this to make sure that you're as accurate as you can be with your captive bolt or with your firearm, because again, I say the midbrain is not that big of an area, and damage to that area is really the objective, because that's what's most likely going to assure death. The other thing that I think you need to keep in mind when you're applying these procedures is you want to make sure that you're correct for the position of the head. Animals can have their head up, like we see here in this bottom middle section here. We can have animals that have their head down more so. And so the angle of the captive bolt or the angle of your shot can drive this particular bullet, or in the case of captive bolt or bolt, into a direction that might miss completely the anatomical, or might miss completely the brain stem. And so keep in mind that what you would like to do is have it enter perpendicular to the skull. You would like your captive bolt or your bullet to enter perpendicular to the skull, right on that X that we just described there. And so you have to try to think as you're working with this animal, maybe it's in a down position or whatever, but you want to try to make sure that your bullet or your bolt enters as best as possible perpendicular to the frontal surface of the skull. The other thing that I see still a lot of people use in the pole position has been outlawed in the European Union for euthanasia, even in their packing plans, and the reason is because it's prone to much greater operator error. And also, the bolt itself, the depth of concussion of the bolt is more shallow, and it oftentimes does not reach these brain stem areas that we would really like to reach. And so the depth of concussion is shallow, resulting in less effective stunning, and oftentimes, depending on how this bolt is held or the direction in which we are holding this device when we fire it, may cause misdirection of the bolt either into the spinal cord or more up into higher parts of the brain, which are not likely or less likely to result in death. So the pole position is problematic and probably not the one that is best for us to use. Instead, use this frontal sight, which are much more likely to accomplish what you're hoping to reach. The other point that I want to make again, euthanasia of calves, I think is a very important issue there. We want to try to make sure that when we're using non-penetrating captive bolt, we want to be sure that we use a follow-up step with that in every case, and we surely would not want to use that for adult euthanasias. The unacceptable methods of euthanasia are these: manually applied blunt force trauma, as with a hammer or some other object like that. Injection of chemical agents or substances into animals, disinfectants, non-anesthetic pharmaceutical agents. We hear those things from time to time. We know that those things go on. We just need to get away from that. That's just not the right way to do this procedure. We don't know for sure how all those things work, but we do know for sure that in some cases it leads to a very, very nasty death. And so we need to get away from those kinds of things. We need to utilize the methods that we know will preserve the welfare of animals. Air injection of the vein is another one that is, of course, not allowed. Electrocution, drowning, and we don't want to exsanguinate conscious animals. Use exsanguination only as a secondary step to assure death. In summary, the methods that we have available to us are anesthetic agents, barbiturates, barbituric acid derivatives, gunshot, penetrating captive bolt, and non-penetrating captive bolt with secondary or adjunctive methods, in other words, to assure death. It's very important, especially when we're using captive bolt. Timely euthanasia is so important. No one likes or wants to do it, of course. The decision is not always black or white. All of us are afraid of the possibility of acting too quickly, but I like what Bernie Rollins says, and I think it's a good thing to remember. Better a week too early than a day too late. I'm not sure that we want to be a whole week too early, but you understand the point of that. And I think it really is the way we kind of want to go with this thing. I think there's far too many animals still die, terrible deaths, and I think that's something that we can fix. We just need to look at the indications of this for euthanasia and apply them as soon as we begin to see this animal is suffering and unlikely to recover. We need to go ahead and ease it to a much more a kinder death. The important thing, as I mentioned, and I've just mentioned a couple times here, some comments relative to training. So important that people understand all of these things. They need to understand what unconsciousness is. They need to understand how to confirm death. They need to understand the proper anatomical sites. They also need to understand that we learn those things and that these things are talked about and stressed in these training programs because animals can and do suffer. And to honor our obligation to animals, we need to be prepared to end suffering as necessary by euthanasia, but we need to make sure that we apply it in timely fashion and do it correctly. We also need to know the proper firearms to select, the proper ammunition, and all those kinds of things, and the proper anatomical sites. You need to know unconscious and how to confirm death. Make sure that your training program includes all of those things so that you can assure that this thing gets done correctly. One of the best items I can think of that you can take a look at, only because I've had some experience with development of this, but I think it's really a good little piece to share with employees and with people that want to learn how to do these procedures, is the Dairy Care 365 training series on euthanasia, making the difficult decision. Dr. Mike Bolton and I worked together on this, and I think it's a pretty good piece. It's in Spanish as well, so if you have Hispanic employees, for example, you can give this particular training for them in Spanish using that system. This is a great series. There are many others, and I know that many of you who are watching this webinar are aware of the introduction to dairy stockmanship that is so well done, low-stress handling of dairy cows and heifers, moving cows to parlors. I review these. I really like these items, this training series. I think it really is excellent. If you haven't had a chance to look at some of these, they're very well done, and I encourage you to take some time to review those when you get a chance. Talk to your Merck representatives. They'd be glad to, I'm sure, help you get get a copy of those. So with that, I will stop, see if there may be any questions or anything that I may not have made very clear in my presentation. So Emily, I'll turn it back to you.
Great, thank you, Dr. Shearer. We do have a number of questions that have come up throughout the presentation. And just as a reminder for those of you who do want to ask some additional questions, there is a Q&A box down in the lower right-hand corner where you can type in questions down there. So Dr. Shearer, the first question we have is, what is the estimated cost of euthanasia by barbiturates on mature cows?
The cost of the pentobarbital to euthanize a mature cow would be somewhere in around the $60 to $70 range. So it's not inexpensive, and so if you had to do many that way, it starts to get quite expensive.
Great, and a similar type of question. What do you recommend when using a gunshot, buckshot or birdshot over a slug? Or why do you recommend buckshot or birdshot over a slug?
Great, and thanks for the question, because that is an important one. A shotgun slug tends to be a little bit of overkill, basically. The other thing is it's possible for that bullet to exit the animal, whereas with buckshot, it's more likely to stay within the animal or within the skull. And so there's a safety feature there to some extent, and the fact that really for close-in shooting that we would do normally with a shotgun and a shotgun slug is really somewhat of an overkill for the purposes that we have here with euthanasia. Not that you can't use it, not saying that you can't use it, but there is some what of a safety issue there that you may want to consider as well.
Great, thank you. Another one that has come in, what happens at the middle brain to cause death?
The midbrain contains the centers for respiration and most of the other bodily functions that are critical to life. And so when we damage the brainstem, essentially we stop all rhythmic breathing, for example, and we stop essentially all other normal bodily functions that are essential for life. So once those are destroyed, it's just a matter of time till it will also stop the heart, because if the animal is not any longer breathing, you see, then eventually it builds up enough carbon dioxide and lacks enough oxygen that eventually even the heart will stop. That's why it takes somewhere around 7.5 to 8 minutes or sometimes longer for the heart to actually stop, because eventually the muscles will all stop, even the heart muscle will stop without any oxygen. And so initially what happens when we destroy the brainstem and the midbrain, it causes a destruction of all of those particular functions that are essential for life.
Excellent, excellent. Another question that's come in is, what are your recommended best ways to train an employee to conduct euthanasia in order to be consistent with the expectations for captive bolt or gunshot?
I think with gunshot, I think one of the most important things is the safety issue. So many people today are not familiar with firearms. I think we've come through a time maybe where employees on farms were familiar with firearms, although we didn't use them for euthanasia as much years past. Today we're applying the procedure of euthanasia more frequently, and oftentimes it's applied by people maybe who don't have a great deal of background and experience with firearms. And so I think one of the most critical things with firearms is to make sure that people understand the safety factors, and then to make sure that we have the right firearm, the right ammunition, in other words, not a hollow point bullet, but a solid point bullet, okay, and then make sure that they know the proper anatomical site. So I think those are key things in there. And then the other key issues that need to be taught when you're training folks is to make sure they understand unconsciousness and death and how to confirm those. And I think that the one, if you want a video option, I think the one video option is the one that is available to you in the Dairy Care series. There are others, and there are websites that have a lot of this information as well. We have one at Iowa State, in fact, that will offer that kind of information as well, and it's in English and in Spanish. But also the Dairy Care 365 series on euthanasia goes through that in a video format as well, and both in English and in Spanish, and I think it covers all of those topics quite well. And again, I think the primary things is the safety issues with respect to firearms versus captive bolts. One, we're going to make sure that the muzzle's against the head, right? That's with the penetrating captive bolt. With firearms, never against the head, because we want to be sure that we don't explode the barrel. And that's what would happen with a firearm, or could happen, quite likely, with a firearm. So those safety features are pretty critical.
Excellent.
Did I answer that question right? I hope I did.
Yes, that was great. Another one that has come in, what are important points of consideration to decide to euthanize a non-ambulatory cow versus attempting rehab on her?
Always a challenging question, right? It's difficult. I think when a cow is down and is not makes no attempt to roll from side to side. She makes no attempt to eat or drink. She may want to lay flat out on her side. She's an animal that's basically saying, I really want to die. And I think those are animals, of course, then that we need to act on. And I think we can make those decisions normally within 12 to 24 hours when we have some of these animals that are really that way. The animals that are more difficult for us are the animals that make attempts to rise and make some attempt to will eat and drink and continue to look bright and alert, and they'll roll from side to side. Those are animals that will take a fair amount of nursing care, but I think those are animals that, in fact, we have some hope for and can get some time to. But I think that animals that are down, that have obvious fractures, that have obvious other pretty serious lesions, and those are ones that I think that we really need to just act on a little sooner. And whenever you've got a problem, get a veterinarian to look at it with you to kind of help you make that decision, because I know sometimes those decisions are not black or white, okay, and it is difficult from time to time to decide. But those are some of the things that I use in looking at these kinds of things. And then I also think that it's good to have another set of eyes from time to time to just take a look at these with you as well, because oftentimes they can do some things to sort out whether you have just a muscle weakness that may be keeping the animal down, or whether you may have fractures or actual nerve damage that is more likely to cause a more permanent kind of condition.
Excellent. And then just at this point, just one more question, and then I think we'll be ready to wrap up. Are there, to your point about working with veterinarians, if a producer would prefer not to euthanize their animals and use their vet clinic to do so, are there any questions that they should ask of the various clinic veterinarians to assure that they conduct euthanasia in the proper manner?
No, great question. I think for the reasons that I suggested, I would prefer, if I'm a dairy farmer and I have to render this animal, or I may have to bury it or whatever, I'm going to prefer that the animal is euthanized either by gunshot or by penetrating captive bolt. And that would be possibly the question that I would ask. And I think that's a totally appropriate kind of a question, because the dairy farmer has got to, in some way, be able to, dispose of this carcass, and it may complicate that process quite a bit. So I don't think there's anything wrong with asking your veterinarian how they do euthanasias and if they would be willing to do it, because I think that most veterinarians today recognize that euthanasia is just a part of their responsibility, because it's pretty hard to raise animals, and have animals of your own and put them to sleep. Okay, it's just not. It doesn't come natural to us, because that's not what we're in this business for. So veterinarians today, I think, are well aware that this is an important service that they provide to their clients, and so you should look for veterinarians that will help you get that done, and will be willing to also look at animals that are down, for example, and that you're trying to make these kinds of decisions on, because I think most veterinarians welcome those kinds of questions and are welcome to do those kind of things for you.
Great. Well, seeing that there are no other questions at this time, we'd like to thank you, Dr. Shearer, again for presenting today. Again, for those of you on the call today, be sure to check out the former webinars that we've done. We've had one on stockmanship and handling as well as on calf care at the bit.ly/Merck webinars. You can access all the webinars. That's where the recordings will be of this one and the webinars that have already taken place, as well as the future webinars. That's where they will be housed. Again, we'd just like to feature the Merck Dairy Care 365 program that is accessible, the training programs that Dr. Shearer mentioned regarding euthanasia and those other areas can be found at www.dairycare365.com. And finally, our next webinar, we are looking still at that, potentially that day of November 3rd, but date and time will still be to be determined at this point, but that will be with Dr. Greg Crosley of Countryside Veterinary Service, discussing how to handle non-ambulatory cattle. So be sure to keep an eye out for the dates and times as we make them available. We should know that here before the end of the week. So we look forward to having all participants back on at that time. Again, just a reminder, if you want to connect with the farm program, we are on all the social media channels of Twitter, Facebook, and Instagram, so be sure to follow us there. And just finally, we thank you all again for attending and participating, and we look forward to having you on our future calls. And we hope you have a great rest of your week, and we'll see you again next time. Thank you.
Very good. Thank you. Thank you. Yeah, I think so.